Today we're going to talk about newborn care, and I have my husband Rob here for the ride today.
Hello.
I'm Dr. Lastra of Head2Toe Pediatrics, and I'm really looking forward to today's video. So why are you the perfect person to help me today?
I don't actually know what we are doing.
Exactly, and that is why you are great. And you also have absolutely no experience with babies.
I've never actually touched a baby.
Or held a baby.
Or held a baby, yeah, no.
So you have absolutely no
physical
idea.
contact with babies, no.
Okay, well today we're going to learn about babies.
Okay.
We're going to learn how to take care of babies.
Okay.
So we have our twin babies here today. We have a baby girl.
What's her name?
What do you want to call her?
This is not my department.
And we have her baby boy. And they were just born. And we're going to take care of them. Okay, so we're going to learn about baby care. So first, you're going to hold them.
Okay.
Don't let the baby fall.
Am I doing it right?
You got to hold both of them at the same time.
Okay, am I doing it right? Like that?
You want to hold it with your elbow like this. There you go. And then this way. So there, you just learned how to hold the baby.
Seems a bit ambitious to do both of these at the same time.
For you, yes.
Okay.
Okay, let's put one down. Let's get to business. Okay. Let's start with our baby boy.
Okay.
So we'll put some things aside.
Mm-hmm.
Actually, let's do this. Okay. So our baby boy was just born.
I'm doing it right?
Yes, you're doing it right.
Okay, just born.
Okay, I'm going to take him back now. Okay. So we have our baby boy here, and you may notice that there's some black thing around the belly button. You know what that may be?
Am I telling you what it actually is, or what I think it is in this imaginary scenario that we're
What you
discussing?
think it is in this imaginary scenario.
Umbilical cord.
Yes, perfect. So black tape here is representing the umbilical cord. So we'll start with talking about the umbilical cord. So when babies are born, we put a clamp and we cut off, and then part of the umbilical cord remains, which we call it the umbilical stump. This umbilical stump will dry and eventually fall off. It usually falls off around 1 to 2 weeks of life. But what's really important to know when you go home with your baby is how to care for this umbilical stump. So, would you bathe the baby?
Not in the bathtub, but I would do like a moist towelette.
Okay, that's great. Yeah. So one of the big reasons why we don't immediately bathe babies when we go home is because of this umbilical stump.
Okay.
So the most important thing to remember about the umbilical stump is that it has to remain dry until it falls. Because if it gets wet and moist, it can create an infection, or it can take longer for it to fall, and it can get red, and it can start to smell bad. So keeping it dry.
Okay.
Now, some people say, like, put alcohol around it, put a coin on top of it. We don't recommend doing any of that. The most important thing is just keeping it dry. It'll take care of itself. Don't get it wet. So like you said initially, when the babies are born, they will get a bath at the hospital. But after you go home with your baby, you just want to be wiping them down with a towel, with a moist washcloth. You want to keep the umbilical cord area dry, and you don't want to be wiping them down daily from head to toe, because the baby skins are going to be very sensitive. Okay?
I like what you did there.
What did I do?
Head to toe. Anyway. Moving on.
Okay, whatever. So baby skins are very sensitive, like we talked about. Okay. The only area that really needs to be cleaned daily is the diaper area. Okay. So let's proceed to the diaper area.
That just so happens to be my kryptonite. Are we going to proceed?
We're going to proceed.
Okay. Right,
and we're actually going to bring back our baby girl.
Okay.
So we're going to get them ready to take care of the diaper area. So we have a boy and a girl here. So some important differences to know about wiping and diapers for our diaper care for boys and girls. Who would you like to start with, the girl or the boy?
Let's start with the girl.
Okay, let's start with the girl, making it more difficult on you.
Great.
Okay, so first we're going to put on a diaper. Do you want to show us how you put on the diaper?
Sure.
Show our viewers here. So maybe this is our diaper changing pad.
Okay.
Let's move some things that we don't need to the side.
Okay, so we're
Go ahead.
gonna kind of scoot this underneath
Move over here.
the legs here. Going to raise the baby and drop. No, this is really wrong, isn't it?
Let me just say, if this was a real baby, poop and pee would have been all over already.
But
as you're changing, they can still pee and poop. So parents, be aware, especially with the boys, they will pee all over you. So you want to get quick at changing diapers.
Okay, so I did this by moving the baby. What did I do wrong?
So you don't want to move. Imagine if this was like a real life-size baby. Would you really be able to move the baby down to put him on the diaper as they're wiggling and moving all over?
No, okay. Let me try again.
Let's try
I have an idea.
Good.
Okay, so we were here.
So you just took off the diaper, right? Now you have to replace it. So one thing important to know, what I tell parents is have everything already ready. So while the diaper's still on, have the diaper that you're going to be changing ready. Have, let's say this are wipes. Have your wipes ready and be ready to do it all. Because if you change the diaper and then you're like, oh no, where are my wipes? Where are my diaper? By that time, the baby's going to pee all over the bed or the changing pad. So you want to have everything available.
Mm-hmm.
Okay, so you just took off the diaper.
And I can't use you to help me, right? This is a one-person. This is a one-person.
Yes, so changing diapers parents should be able to change their diapers on their own.
Okay, got it.
Each person individually needs to learn how to do it.
Okay, here we go.
You will help, and you can have help in the real scenario. But for today, you're going really fast there. That was better. So yes, you lifted the legs up. So that's what's important. You got to keep the baby. Usually the legs will be in this orientation, and you lift and put. But you forgot to wipe.
Forgot to wipe?
Yeah, you took off a diaper and there's poop all over, and you just put a new diaper.
What do I wipe with?
Remember, these are our imaginary wipes.
Oh yeah, I forgot about that. Okay.
Okay. So let's talk about wiping. So you have a girl here. So what I like to do is I lift her little legs and then I immediately put the diaper under, right? Or as you're changing, let's say this is the dirty diaper, I lift, I grab wipes, I clean, then I put the wipe on the dirty diaper, fold it, flip it out, and then flip right back in the new one. But let's talk about wiping because the wiping is important. So you have a baby girl. So how are you going to wipe the baby girls?
You would wipe front to back.
Okay.
Right?
Yes. You got it.
Okay.
So do not wipe back to front. So let's say we've got our imaginary wipe that we grabbed from here. You want to wipe front to back, front to back, front to back. Okay? You don't have to open the area or go looking there to get everything out. You're just wiping front to back. Okay? Don't wipe back to front because that will bring some of the stool forward and that could cause urine infections if you're doing that continuously all the time. And don't wipe just kind of all around. So front to back. Okay? You graduated from doing diapers.
So I don't have to do diapers anymore, right?
No more diapers.
Okay, perfect.
Then we tie it. They'll usually bring their legs down. And that is our baby with a diaper.
Okay, bring on the boy.
Okay. So now we have a baby boy. So how are we going to wipe for our baby boy?
You know, this should make more sense to me, but actually this makes less sense to me.
Okay.
So how we should wipe. So you could say you could do it the same way. You certainly wouldn't want to go forward to back. I know that UTIs are less likely to happen in males than females.
UTI meaning urine infection.
Urine infection, yeah. Okay. Not to get too inside baseball, the abbreviation. I guess I would do like spot there and then go below the testicles.
Same wipe or would you change?
Oh man. I mean, it's a very leading question you just asked me, so I will say change.
Yes, you don't want to use the same one. But the biggest thing with the baby boys is that the poop can hide underneath the testicles. So you want to make sure you're lifting the testicles and wiping under the testicles. Okay? So there's no right or wrong on like front to back, back to front. Here you could go all around. Mm-hmm. But again, things can hide underneath the testicles, so lift and wipe. And then also for both boys and girls in the creases. So the creases are these areas right here in between the legs and the pubic area. So you want to wipe in there too because you can get some of the stool specifically. With urine, you don't have to worry so much about wiping. It's more so with the poop. When babies are first born, their poop, we call it meconium. And that meconium poop, we call it meconium because it's very black, very thick, very sticky. Not so much thick, very sticky. So it's really hard to get it off. Okay. And that'll be normal for about the first 2 days until the poop starts to transition and more into that normal baby poop. Okay. So that is going to be really hard to wipe, and that's going to be the hardest part of changing diapers for the babies.
Question.
Yes.
Instead of wiping, could we have like a dunking tank that I can take the baby and like dunk like this, hold, dunk, and then bring out, and then... But
what if we talk about that black thing there?
Oh, yeah, no. No. Don't do that.
We do not want to get the umbilical stump cut.
Right.
That was a great question. Okay. But yes, not initially. Once the umbilical stump falls, if you're changing a diaper during a bath time, it will be great because then you don't have to worry so much about getting all the stool out because you're just going to bathe them right after.
And what about smart diapers? Is that a thing?
I'm sure you will find a smart diaper. No.
I think there are smart diapers, but I don't think they do what I want them to do in this case. Like, they don't clean, but I think they tell you when it's time for changing.
I haven't come across those, but I would love for you to...
We'll put them in the show notes. We'll tell you what we're...
Yeah, you tell me. Okay, so we talked about that. The other important thing to know about the baby boys is if you chose to circumcise your baby boy, the circumcision, once it's done, you also don't want to get that area wet, similar to the umbilical stump, for a week after the circumcision was done or whatever your doctor tells you.
But you said that wiping is okay.
The wiping is okay. So you don't want to be dunking again either. That's another reason why you wouldn't want to dunk in water because you want to wait for the circumcision site to heal. With the circumcision, it can look red and swollen for the first few days. You may see some white tissue growing. The most important thing is when you're changing the diaper, if your baby is circumcised, is to apply Vaseline to the area so it doesn't stick to the diaper. Okay? So with every diaper change, lots of Vaseline and load it up right in the area. Okay, you did great with changing diapers.
Yeah, you hear that? So, hear that, viewers? I did great.